calories from that, and then also getting the immune benefits from your breast milk from that standpoint as well.
Yeah, there's definitely more formula in the bottle than in the breast milk.
Correct.
I'm just topping it off.
Yeah, and I think that would be a
Right.
good ratio.
And and I understand the immunities. I mean, he hasn't had an infection.
Correct.
So that has to be from my antibodies through the breast milk.
Mm-hmm. Yeah, but also realize he's at risk for a different kind of infection, the bacteria infection called the cholangitis,
Right.
From the Kasai procedure he had, where you put a loop of intestine up there on the liver. And that's part of the reason why you're here to see us today is with biliary atresia, sometimes that procedure works really well and the jaundice goes away, and meaning the yellowness of the skin, and the growth does really well, and kids run around for years with these Kasais. With him though, we're looking at the level of jaundice that he's having at this point. We kind of like to use the 2 to 3 month mark to really kind of fully assess, so past the Kasai procedure. So he was roughly how old at the Kasai?
It was 4 weeks.
4 weeks, so it was 1 month. Okay,
Yeah.
so we're about, is he over 3 months now?
Yeah.
Like, is it
He
2
turned-
or 4?
He turned 3 months on May 27th, my birthday.
Okay, so about 2. So we're about 2.5 months out from that Kasai from that standpoint. So we're kind of getting on the tail end of saying, okay, is this going to work? It's going to work versus, this may be something that it maybe delayed the progression of the liver disease, but we may be talking liver transplant sooner rather than later, okay, which is kind of the reason why you're here, because that's the ultimate treatment for biliary atresia,
Yeah.
is 95% of the kids will need a liver transplant. It's whether it's within the first year of life, first 5 years of life, first 10 years of life, all of that depends on the function of the Kasai. And a lot, with the Kasai, a lot of it, it's, you do your best that you can and kind of see what's left from that standpoint, okay? So that's kind of related to why you're here today, to kind of evaluate. What we look for in addition to the Kasai functioning. Hey,
Hi.
this is Dr. McKenzie.
Hi. Hello, everyone. This is the definition of a
Yeah.
You were supposed to bring the potato salad.
Oh, my dad actually makes a pretty good potato salad. I don't think I can make it, but
So we were just talking about, first these are a variety of grandparents
Yes.
and then mom and dad.
very good. Hi.
So we were just talking about, it's been about 5 weeks on the 2/3 progesterone, 1/3 breast milk
Okay.
from that standpoint. And that it's been about 2.5 months since the Kasai, and that we look at like the 3-month mark to kind of really say, okay, is this Kasai successful, or is it something that we're progressing further to liver transplant? And that's kind of where we got. It's not just the jaundice alone, though, that will dictate, okay, when does he need a liver transplant? We look for other signs that the liver disease is progressing, meaning that he's getting more scarring inside of his liver, okay? One of the things that will help us with that is an ultrasound,
Okay.
which Sarah, are we getting an ultrasound today? Great. And that will just let us know the size of his liver and also if there's any pressure in the blood vessels that lead to his liver. Have you heard the term portal hypertension?
I have.
Okay.
And I'm more familiar with the portal vein.
Yes,
Because I don't want that to erupt and then there'd be blood and.
you got it.
Okay.
So what the portal vein is, that's the big blood vessel that goes to the liver. Normally blood flow should go in. I don't know if you got a picture there or not.
Wow, look at that.
Wow.
Yeah.
She's prepared.
And what happens is as the liver gets scarred down, it's harder for the blood flow to go in, and so it reverses itself. Okay, now obviously the blood's got to go somewhere. So the other organ that the portal vein's connected to is the spleen, and so you'll feel us documenting the size of the spleen as that starts to get bigger. But there's also little, what we call collateral blood vessels, often the size of a spaghetti noodle, that wrap around your esophagus and your other part of your intestines. And again, it's kind of like a traffic stop. Okay, blood can't go this way, so now it's going to go this way to the spleen, and it's also going to enlarge those blood vessels that are around the esophagus, and so they get a little bit bigger, kind of the size of the pinky. And that's what's called a varice. Okay, and so that's what you have to watch closely for, which I understand you guys had some bleeding,
Yeah.
a couple of days ago, which.
And we had some more in the diapers. 3 yesterday and 1 this morning.
Yeah, so tell me the nature of the bleeding. What did it look like?
It's the first diaper that I showed the ER. It was all around like the corners
Okay.
of the diaper and specks all over.
And what color? I'm sorry, is it bright red? Was it dark
Bright red.
color? Okay.
Okay, specks all over.
Okay.
Then it would go to just 1 speck.
Okay.
One, smidgen of blood. And then, so yesterday it was 3 times. They were all 1 smidgen of blood.
Okay. And still the bright red
Yes.
specks that you'd see.
Yeah.
Okay. So the type of bleeding I'm talking about tends to come from the upper part of the GI tract, so that by the time it makes its way down to your poop, it's already been digested and turns to a really black color, very foul smelling. The type of blood that you're describing to me suggests that it's coming down from lower from his GI tract, And not saying that you can't have these blood vessels develop down lower, but it's a little bit more unusual. And again, the volume of the blood tends to be more copious, to be honest, okay? And it's interesting, these little flecks of blood can sometimes relate to something completely unrelated to his liver disease, called a milk protein allergy, okay? And yeah, and this is about the time that it kind of presents. And it's actually, and again, not at all related to his liver disease. What's happening is his intestines can't break down the milk protein he's seeing from your breast milk.
Yep.
It's not the progesterol, because the progesterol is already broken down. So I think we need to kind of circle back around to the whole breast milk argument and kind of how strongly you feel about continuing to supplement